Well, we've all heard of carpal tunnel, but what exactly is carpal tunnel syndrome? What happens? What's the problem?
Good question. Carpus is just a fancy word for wrist. So carpal tunnel is a tunnel that's in your wrist. It's made up of carpal bones, wrist bones, and a ligament that goes across the top. And through that tunnel go all the flexor tendons to your fingers and a nerve that supplies sensation to these 4 fingers. And when the nerve gets squished, the blood can't flow to the nerve, and so you get ischemia, which is a fancy word for lack of blood supply to that nerve. And the nerve doesn't like that, and it responds with numbness and tingling in these 4 fingers. And people will come in complaining not of ischemia of their hand, but they'll say, my hands are falling asleep, primarily at night. It'll wake them from asleep at night. People will come in saying they're shaking their hands at night, or putting their hand over the edge of the bed to get the circulation back, basically, but they're not quite sure why they're doing that. Or when it gets bad, it actually spills over to the daytime. And they'll get daytime symptoms such as when they're talking on the phone, they have to switch hands and use the other hand because they have to shake out with the other hand. Reading the newspaper, they have to put the newspaper down. And there are wonderful things that we can do for this, which people don't recognize. One of the things that we can do is splinting. So if you're just having nighttime symptoms, we give you a splint called a carpal tunnel splint, which you can get at any drugstore. And that prevents you from flexing your wrists at night. When you flex it, that puts more pressure on the nerve, less blood flow, and the more symptoms you have. And then that's usually temporary, and then people start having the symptoms during the day. And then when you do, you can get carpal tunnel surgery. And people don't also, I don't think, realize how quick the recovery is.
Yeah, that sounds scary. But it's
does.
not that involved. I mean, as in time that it takes in recovery and everything.
When you attach the word surgical to anything, people do get afraid. I think, you know, they feel like they don't have control when they go into the operating room, they're going to sleep, and, you know, anything can happen. But it's a very straightforward procedure. I do hundreds a year. And they have a new way of doing the new, meaning in the last decade, of carpal tunnel surgery. The surgery involves cutting the ligament in the hand, but you can do it through a small incision and put a scope in with a tiny camera in and cut it that way. It takes 10 minutes. People are in and out the same day, and it depends on what kind of work you do. You can go back to work the next day if you do secretarial work, or if you're heavy manual labor, probably about 3 weeks you want to wait before you start lifting heavy things.
And do they have immediate relief?
Immediate relief. That's one of the great things about being a surgeon, is that you provide almost instantaneous resolution of somebody's symptoms with the carpal tunnel release. In the recovery room, people will say their hands got better and the tingling goes away.